Hi, welcome to Module 5, Child Health and Safety, and this is Part 1. Our objectives for this module are to provide participants with knowledge on the licensing regulations that govern health practices, requirements, and record keeping, guidelines regarding nutrition and food preparation in early childhood settings, and information on how to create learning environments that protect the health and safety of young children. I just want to throw this out here that a lot of what we're talking about this week is in regards to licensing, and you can find the licensing rules and regulations at the website listed here, and these are for Colorado. It's really important that as an early childhood educator that you are familiar with these rules and regulations, because when you sign on to take a job in a licensed child care setting, you are essentially saying that you will follow and adhere to the licensing rules and regulations, and so you should be familiar with what those are. So we're going to talk about health and safety in regards to licensing, in regards to policies that get put into place in programs. So all centers have health policies, and they're really there to keep children safe and healthy. And one of the basic things is that all employees should know how to handle injuries, illnesses, and emergencies. And we know that healthy children have their physical, mental, and social well-beings met, and we also know based on previous conversations that heredity and environment are both important, and so some of the things that make up healthy children are nutrition and dietary habits, daily physical activity, personal hygiene, regular medical and dental care, clean and safe home and school environments, and respectful and stable relationships. So thinking of those, the list that we just talked about, there are objectives for guiding health, and so here they are. So centers need to develop health policies, they need to review children's health records to ensure they receive immunizations, they need to recognize ill children when making daily health observations, they need to isolate children who may have an illness from the group, contact parents about health issues, plan a safe environment to prevent health issues, provide first aid treatment, take part in health-related in-service training, and they should include health in the curriculum. So, for instance, all staff should be trained in CPR and first aid, although licensing does not state that everybody does. Most programs, that's pretty common practice. And these objectives are what help guide licensing rules and regulations, and they also help us as early childhood practitioners determine best practice when it comes to health and safety. So let's talk a little bit about what a policy is. So a policy is a course of action that controls any future decisions. So you put policies in place so that you know what to do in any given situation. So centers make policies on things like immunizations, administering medication, exclusion policies, napping, medical examination, daily health inspections, contacting parents, personal hygiene, environmental control, hand washing, and sanitizing and disinfecting. We're going to go over most of these policies in detail in the next couple of slides, but a couple that we won't, that I just want to briefly mention, is the exclusion policy, and this may vary by center, but licensing does state that it should be determined by a healthcare provider, so this is when you decide that a child cannot come to school due to an illness. We will also not go over medical administration. You must take special training to do this, medication administration. So what I always like to say is that if a parent ever tries to hand you medication, do not take it and have them redirect them back to program administration. If you have never been trained in giving medication to a child, please don't ever do so. Licensing also states that there must be a policy in place for contacting parents in case of an accident or emergency or an injury. And when we think of health and safety, it's about the spacing between children and making sure sheets are cleaned weekly in terms of nap, and that cots are sanitized, and that children get rest time but are not forced to sleep. The rest of the policies on here we will go over. So, medical examination. Basically what this states is that in order for a child to enter into a center, the family must provide them with a healthcare form within 30 days of enrollment, and all staff actually must have a current physical on file, because staff must be in their best physical, mental, and emotional health, because we know how hard this job can be. In terms of contagious diseases, the center must have a policy in place for notifying the health department of any contagious diseases in the center. There's a list of what contagious diseases are, and you must respect confidentiality. So if a parent does come and say, my child has mumps, it is your job to protect the confidentiality of that family, but still report that to the health department. So immunizations, all children attending the center must have proper immunizations required by the state. A family can exempt for religious or medical reasons. This form has to be turned in on the day they start or before they start. And also staff should be up to date on their immunizations. So licensing wants this piece of paper from both you and the families that basically states that you are up to date. And there are reasonings behind that. So daily health inspections are a best practice, but also a Head Start requirement. And so this is when you are observing all children as they arrive, and you're trying to look at their overall health. So you're looking for rashes or sores, swelling or bruising, changes in the appearance of eyes, runny noses, coughing, sneezing, flushing of the skin, or a sweaty appearance. And sometimes this requires having a conversation with the parent at drop-off in the morning. But on top of that, you're also supposed to be observing throughout the day to make sure that children are healthy. Environmental control is also really important in early childhood centers because you need sanitary practices to keep the environment clean. Environmental control is important because it helps prevent the transmission of diseases, and so you should have written health policies for hand washing, diapering and toileting, and cleaning and disinfecting. Hand washing is the best thing that you can do to prevent the spread of contagious diseases. I'm not going to teach you how to wash your hands. I'm sure that you guys all know how to do that. But one of the things that you do need to do as an early childhood educator is make sure that you are supervising children for proper hand washing technique and that you're teaching them the proper hand washing technique. And yeah, it's important. It's important to stop the spread of germs. The other things that centers must have in place is a way to sanitize and disinfect, and there is a difference between the two. So sanitizing is removing dirt or soil and a small amount of bacteria, and disinfecting is eliminating germs from the surface. So you can think of sanitizing as almost the soap piece and disinfect it as like the bleach. So this does fall in line with what we call standard precautions or universal precautions, and so this shows programs what to do if you are exposed to blood or bodily fluid. And really the biggest thing is that you should consider all bodily fluids potentially dangerous. I also think that it's important to note that major cleaning should not be done with children in the room, and make sure that you're reading labels to the bottles of the cleaner that you are and you're using them properly. Licensing will ding you on that if you are not doing it. You need to make sure you're using gloves, and make sure that when you are doing disinfecting, that air dried is a preferred method for getting the most germs off. So, when should you wear gloves? You should wear gloves when cleaning, serving food, changing diapers, dealing with bodily fluids, and or administrating first aid. Basically, you should wear gloves anytime you think that you may need to protect yourself from any type of bodily fluid or any type of germ that you don't necessarily want. There is a proper way to take gloves on and off that is taught to you during universal precautions, and we will not go over in this class. There is also steps for diaper changing. I'm not going to walk through these steps for you, but here they are if you would like to read them. This is just a reminder that licensing has certain expectations for changing diapers, and they should be following proper diaper changing procedures. Licensing will actually ding you if you are not. So make sure that you're aware of those, especially those of you who are working with infants and toddlers. So first aid is an important part of our job. All employees in child care should be certified in first aid, although I want to point out that licensing does not state that everybody has to be certified, although most programs do that. You should have a first aid somewhere available in a classroom, and it should be available to staff at all times, but kept out of reach of children and maintained. So a lot of times I see first aid bags hanging on hooks by the doors to go outside. First aid kits should include Band-Aids, tape, gauze, disposable gloves, and compression Band-Aids, and you should be using gloves when administering first aid. You need to store all basic first aid supplies together. You can't keep supplies in a locked cabinet because you need to be able to access them easily. You need to replace supplies when used. You need to keep supplies for special needs handy as well, so those include things like EpiPens, and you need to check and restock this on at least a monthly basis. So So I do want to touch briefly on playing outdoors safely. Be mindful that licensing does not give any indications around when children can and cannot be outside. Every program is different, so you need to make sure that you know your program's guidelines. Centers should provide a form for parents to fill out in terms of sunscreen, and bottles should be labeled with the child's first and last name. You need to make sure that children are staying hydrated and that you are applying sunscreen at least 30 minutes before going outside. This is a typical weather guideline that we see sometimes in classrooms, but again, make sure you understand your program's expectations. You should also have somewhere where you are keeping special health concerns on record, and this can include things like allergies, asthma, diabetes, epilepsy, HIV, AIDS. A lot of times this information is kept in a binder or folder. You should always be aware and ask whenever you're assisting in a new classroom if there are any special health concerns. So I do want to go over briefly safe sleep, especially for our infant and toddler teachers. So there are two terms that I want you to be aware of in terms of safe sleep. One of them is SUID, and this is an umbrella term for all unexplained and unexplained infant deaths that occur in the sleep environment. Sudden infant death syndrome is slightly different from SUID in that sudden infant death syndrome is unexplained after a thorough investigation. So if a child dies in an environment and it's due to suffocation or maybe child abuse, like they were shaken and then put down, that still falls under SUID. But if a child dies in a sleeping environment and it is unexplained after an investigation, that is SIDS. Although it still falls under SUID, it's just that is unexplained instead of explained. So, what you should be doing as an early childhood educator is that you should be making a combination of creating safe sleep environment and implementing safe sleep practices. And it's important for you to recognize who is at risk. I'm not going to read those to you. Just take a few seconds to look over the who is at risk, and then we're going to talk about safe sleeping environment and safe sleep practices. So safe sleep environment means that all cribs meet consumer product safety standards, that babies are always asleep in a smoke-free area, always asleep in their own sleep surface, no toys, soft bedding, blankets, nothing in the crib, that you're avoiding wedges, positioners, and other products that claim to reduce SIDS. Safe sleep practices are what you do. So you are constantly placing infants on their backs, you're avoiding overheating, you're introducing a pacifier, you are avoiding second or third hand smoke, you're encouraging breastfeeding, and you are making sure that infants are up to date on immunizations. So we are going to talk about active supervision when we meet on Tuesday night, but it's really important for you to understand that young children are fearless, unpredictable, and quick. It is your job as an early childhood educator to keep young children safe, and you do this through active supervision. And you do this through these tips that are listed on this slide, but we are going to go over this on Tuesday night. One other way that you keep up with active supervision is by maintaining ratios. So it's important for you to understand the ratios in regards to licensing, but also from your program, because sometimes they differ. A classroom should really never have fewer adults than required by the state law, and failure to require with those may mean that licensing gets revoked. It's also a part of your job to develop safety limits with children. So safety limits are also known as rules, and they reflect the goals of a program. They're used to protect children in our care, and they should be clear, simple, and easy for children to understand. So some examples of safety limits are listed here on the slide. You can take a few seconds to read them over. It's important to know that children should be reminded of safety limits, but it should also be consistent. So your safety limits should not change from day to day. The other thing that you need to do is provide a safe environment. So you need to check toys and materials for safety and discard broken things. The playground equipment must be safe and supervised. There should be some sort of building security. You should have a plan for emergency disaster preparedness. There should be a written plan for evacuating children, and there should be a safety procedure for a lockdown. And it also must cover things like floods, fires, tornadoes, and live shootings. So next week, we've already talked about this, but you have your first discussion question, a copy of a weekly food menu, and then your practicum, so an article on health, safety, and nutrition, and that includes a summary. If you have any questions, go ahead and reach out.